And our final speaker on the panel today is Airlín Pérez Carrascal, who is a Humphrey Fellow at the University of Minnesota and a social activist in Cartagena, in Colombia, who is speaking on Afro-descendant populations in Cartagena and the COVID-19 crisis and intersectional analysis.
Okay, thank you so much. Please let me know when I have 5 minutes left. My name is Airlín Pérez. Thank you so much, Toby, Michael, Aleid, and the rest of the team that have created this space to debate and talk about kind of our perspective about COVID-19 in Latin American countries, but also how African descendant people face up the COVID-19. So I am an activist. I will give my perception and my point of view based on how I live the COVID-19 pandemic. I am part of a Black social movement in Cartagena, and also as professor and researcher at the University in Cartagena. Here you can see like an image about El pueblo no se rinde carajo. That is in Spanish. That el pueblo, people don't give up. So that I chose this because that reflects on how our communities and how our people and how African descendant women, we face out the pandemic. So we didn't give up in face, also like thinking about the oppressions that we have faced. Then I will give a context about what is the meaning of being African descendant in Cartagena, where African descendant people are, and also what we were living in Colombia at the time of the COVID-19 pandemic, and also the impact of COVID-19 for African descendant communities, and what is about the final recommendations or comments that I can give to institutions, states, and also for community organizer people that try to think about communities that have the power to break hierarchy oppressions. Then Cartagena is a city placed in the Caribbean Sea of Colombia. It is located on the north side of the country and is immersed in a historical cultural legacy of settlements of African descendants and indigenous communities. This high percentage of African descendant people is related since 15th century when Cartagena de Indias worked as the main slave trade town in the Americas. So you can see the map. We are surrounded by the Caribbean Sea. And also the second picture it was the main entrance of the enslaved people in the 15th century. So the impact of African and also the impact of slavery in our territory and in our communities is really huge. And also the kinds of conditions that we live also have an impact of it reflects the slavery times and the coloniality of power and also the colonial times the post-colonial time that we are facing now. Okay, so based on the census in 2005, showed that 35.7% of the Cartagena population self-identify as African descendant, which compared to the main cities of the country registered the highest percentage, followed by Cali, Barranquilla, Medellín, Bucaramanga, and Bogotá. In Colombia, this percentage reached 10.6% of the total population, as you can see in the picture. I don't know if we can expand the pictures no? Okay. At a geographic and social spatial level in Cartagena de Indias, the Afro-descendant population is highly concentrated in the Ciénaga de la Virgen. I will show you here. So Ciénaga de la Virgen is this part of the map. Okay, so this part of Ciénaga de la Virgen and is surrounded by water. So you can imagine thank you, good. So we are highly concentrated in Ciénaga de la Virgen, that you can see over there. And it's made up of 51 neighborhoods belonging to communities 2, 3, 4, and 5, and 6. All of them have a straight socioeconomic level of 1, 2, and 3. We've covered a fifth of the urban area of the city. Some of these neighborhoods are residential areas developed by private builders and other informal settlements that have been consolidated over time. And from the institutional narrative, these kinds of areas where most of African descendant people live are at high risk, and also they have to be preserved. And that's the narrative that people in the state have used to displace Black people and African descendant people to other places, because they have created the narrative that we have been settled in places at risk, but also Cartagena is a touristic area. And you can imagine how the tourism development and the neoliberal development has been used to displace Black people and African descendant people to build buildings and big hotels for the high and elite economic population. Then, here where we are, you can see, this is the percentage of the illiterate population by sessions, and it have a match. It match with the African descendant people. The red part that you can see in the map is where we are concentrated. And here in this map, you can see that it matches with the percentage of people that don't read and don't have access to information. And also the same map have a really relation with healthcare system and also with poverty and all those kinds of social economic categories that we have to analyze in terms of segregation. So many people have research about what about African descendant people in Cartagena, and also there is a cluster, so there are many people, we live at the same area, and it seems to me that we are living after the slavery time. We abolished slavery, but we also are facing a social racial segregation in our city. And the impact of the COVID-19 also have been related to how the city is segregated and also who are the most impacted people with this COVID-19. Then, this about Colombia, what was happening at that time during the COVID-19. So we were facing a social strike, the national strike, because the government decided to start a tax reform. But this tax reform benefits the high-income people and also the elite. And we took the streets, we mobilized our communities, and also it was an affection for the COVID-19, because one of the restrictions was not to go to streets and to take and to mobilize our anger and also our how uncomfortable we were with the tax reform. But this national strike took a long period from April 2021 to June 2021. So COVID-19 was not an obstacle for communities, and especially for African descendant communities, to mobilize. Then, taking into account the census and also the data, in 2022, Cartagena de Indias was the highest, was and had a higher level of monetary poverty, with 40% percentage of the population, equivalent to that kind of people, for 421,000 people from Cartagena who cannot access food, housing, and other basic necessities. So the COVID-19 exacerbate the disparities, but the problem with this data is that they talk about poverty in general, but they don't mention who are the ones who have been impacted by poverty. And we know who were those people. Yes, it was our communities, were our families, were our people, and especially Black and African descendant women. Why? Because most of African descendant women, we are in an informal works, and also most of our cousins, aunties and our families that have been in charge of women, of African descendant women, they have not access to work, and they have been doing their work in informal market, public markets that were closed during the pandemic. With the social movement, we created we start to put into the debate the narrative and also the conversation about who were those people who were dying not by COVID-19, but who were dying because they couldn't access to food. And we said that Black people in Cartagena are starving. and also are dying because of being hunger. In Spanish is la gente negra en Cartagena está pasando hambre, no? Like when you are hungry. Those are also the statistic of the percentage of African descendant people who died because of COVID-19. If we compare the total population in Cartagena and those people who don't recognize themselves as African descendant in those communities that recognize themselves as African descendant, we will see that the percentage of fatality were higher in African descendant people. So that's an important data for institutions that want to create like a different public policy to recover or to give back the rights for African descendant people. They have to consider that the impact of the COVID-19 were totally different for us in comparison with the rest of people. Here we have a picture about them. If you can explain this, it would be important, please. This was part of the strategies that most of the African descendant communities use. It was about communitarian pot in order to not die of being hungry. So we created that, and part of the narrative that we use was, I don't know if you can go there. If you can put the slides maybe on the left to read. Okay, if you can reduce that, it would be good. If you can reduce that, yeah, okay. So we said that the consequences of an unequal economic system, the inequitable distribution of wealth, structural racism, and the commodification of public goods lead us to leave the lockdown without guarantee of rights. So that was part of our narrative there. And finally, I want to point out that institutions and state, the government, use a racist narrative to try to look for to measure the COVID-19 pandemic and also to try to resolve the problem. They said in a decree, they imposed a decree that said that there will not be retail sales taking into account the high contagion factor that the Basurto market, that where of most African descendant women work, because of the contagious factor that the Basurto market had been due to the disorder and social indiscipline. So those kind of words, like a disorder, social indiscipline, contagious, infection, so those kinds of words were used in order to expand the stereotype of African descendant people, of black people, and also to make people think that we were the ones who were spreading this and not the touristic, and not the tourism or the people who came from other parts of the country. And we are almost finishing, right? And also, part of the impact that most of African descendant people live was the police brutality in Cartagena. So most of them impacted for youth people. The same decree that continued the stereotype, the narrative, the racist narrative about black women, black people who were working in the public market as contagious, as infections, as indiscipline, was used to militarize our neighborhoods and communities. So the same decree mentioned that the police must carry out controls on the mandatory use of masks and any element that covers the mouths and nose of people who circulate through Basurto market and the area of influence, and also they can use control on consumption of alcoholic beverage, and also those people who throw out parties. We have our culture to be in community, to throw out parties with our families, but we knew that we had to reduce that. But something different is that when you take decisions by yourself, and in comparison when you have a militarization, when you have police in your neighborhoods controlling it, and it put our people to, they kill most of 6 youth people in different neighborhoods in Cartagena during the COVID-19 due to this decree of militarization in our neighborhood. So it is a connection between how the states and government engage different kinds of practices to try to look for a solution, but at the same time, that solution exacerbates disparities and make African descendant people to live with no dignity and to reproduce the racial segregation and also the exclusion. So thank you so much.